John Hoven once said, caring for our seniors is perhaps the greatest responsibility we have. Those who walked before us have given so much and made possible the life we all enjoy. Good day, College of Nursing, fellow researchers and viewers. The BSN 3F Group 2B from the University of St. LaSalle College of Nursing would like to present to you a research study entitled The Knowledge and Attitudes of Nursing Students in the Care of Elderly. I am Lyn Marie Guanzon, and together with me are Jullian, Angelo, Fermin, John Fritz, Keno, Grijaldo, and John Francis Emmanuel Guatelara. To officially begin our presentation, I will now discuss both the purpose and the objectives of our study. So this study aimed to determine the level of knowledge and attitudes of Level 3 and Level 4 nursing students in the care of elderly. For our objectives of the study, what is the demographic profile of the participants based on age, sex, section, and year level? Second, what is the level of knowledge of nursing students in the care of the elderly? Third, what is the attitude of nursing students in the care of elderly? Fourth, is there a significant relationship between the level of knowledge and the profile variables of participants in terms of age, sex, section, and year level? And lastly, is there a significant relationship between the attitudes and the profile variables of the participants in terms of age, sex, section, and year level?
Next, for our methodology, correlational quantitative research design was used to attain the results of this study. For the participants of the study, a sample population of 207 level 3 and 4 nursing students at a local university in Bacolod City, and they were selected by means of the stratified random sampling method and computed by using the Rao-Soft calculator with 5% margin of error. And for our research instrument, a standardized instrument divided into 3 parts was used. Part 1 consists of the demographic data of the participants, Part 2 consists of the level of knowledge, and Part 3 consists of the level of attitude.
For our results and discussion, first is our demographic profile. In terms of age, 21 years old and below of nursing students have 50.2%. As for 21 years old and above, constitutes 49.8% of the population. Next is for sex. With regards to sex, 72% of the participants are female nursing students, whereas 28% are male nursing students. And for P section, participants coming from section 3AE and 4ABDG had the highest number of participants, accounting for 8.2% each, and section 4F had the lowest number. And last is for our year level. Population coming from level 3 had the greatest number of participants, accounting for 54.1%, and for level 4 with only 45.9%.
Table 2 shows the level of knowledge of participants in the care of elderly. As presented in the table, the mean knowledge score and the SD score indicate a verbal interpretation of good. This signifies that there is a good level of knowledge among the participants of the study.
For the table 3, this is the level of attitude of nursing students in the care of elderly. The means and the SD shows a high level of attitude of nursing students.
Next, table 4 shows the relationship between level of knowledge and the demographic profile. So the table shows that there is no significant relationship between the level of knowledge and profile variable age, sex, and year level. Therefore, the null hypothesis is not rejected at 5% level of significance. The result indicates that age, sex, and year level are not indicators in the level of knowledge. However, there is a weak significant relationship between the level of knowledge and profile variable section. Therefore, the null hypothesis is rejected at 5% level of significance. The result indicates that section is an indicator in the level of knowledge of nursing students towards care of the elderly. Next, table 5 shows the relationship between level of attitude and demographic profile. So the table shows that there is no significant relationship between the level of attitude and profile variable age, section, and year level. Therefore, the null hypothesis is not rejected at 5% level of significance. The result indicates that age, section, and year level are not indicators in the level of attitude of nursing students towards care in the elderly. However, there is a weak significant relationship between the level of attitude and profile variable sex. Therefore, the null hypothesis is rejected at 5% level of significance. The result indicates that sex is an indicator in the level of attitude of nursing students towards the care of the elderly.
For our conclusion, the demographic profile of the nursing students reveals that majority are 21 years old and below, predominantly female, and mostly from level 3. Female nursing students tend to have more positive attitudes towards older people. The study shows that age, section, and year level are not indicators of the level of attitude of nursing students towards the care of the elderly. However, there is a weak significant relationship between the level of attitude and profile variable sex, with female nursing students having more positive attitudes towards older people compared to male nursing students. The results conclude that level 3 and level 4 nursing students generally have good knowledge and positive attitude towards elderly care.
As for the recommendation, the sectors involved can take the following recommendations into considerations in light of the study's findings and conclusion. School administrators, it has been suggested that school administrators should establish programs and campaigns to address the absence of care for older patients and improve their quality of life. Next is clinical instructors. The study's findings to assist clinical instructors obtain a better grasp of how to manage their individual health needs, improve patient outcomes, and prevent problems. Next is nursing students. Nursing students may benefit from this research, particularly in recognizing the need of nurses towards the care of the elderly and knowing how to cope or respond in given challenges in future exposure to the healthcare setting. Next is nurses. Based on the findings of this study, it is recommended that nurses should continue to develop their knowledge and skills in the care of the elderly to provide high quality and patient-centered care. Lastly is the future researchers. By acknowledging the study, future researchers are advised to expand the study sample size in order to collect a larger range of data and thus arrive at more significant findings.